Welcome everyone. You're listening to the ICA India podcast. Through the podcast series, we hope to bring out multidisciplinary dialogues by discussing the intersections of economics, policy, and cancer.
Welcome everyone. This is Smita Srinivas. This is the new episode of our ICA India project podcasts. This is the Innovation for Cancer Care in Africa project, and we are the India team with the great pleasure today of being joined by the CEO of STEER, Mr. Janak Nabar, and with Dr. Dinar Kale, who is at the Open University in the Development Policy Group. And both of them are a highly individual, strongly researched team members who are working together as well as separately. I've had the pleasure of working with both of them in different capacities. And it's a chance for us today to delve in a little bit deeper into the entire slightly mysterious and extremely important area of medical devices and diagnostics. Thank you, Janak and Dinar, for being here today.
Thanks, Smita. Thanks for having me.
What should be the next step, as in, given the pandemic and the crisis and everything that we're going through, what should be the next step which governments should follow to increase accessibility and affordability? How do we reach that goal?
It's a really big challenge. And, what we really need to think about is something which we are discussing in ICA, and Smita has been talking about it in her triad, is some industrialization for health agenda. That's what we need. That there has to be a close alignment between the health policy and industrial policy. It comes from the creating the access to finance, changing the procurement policy, changing the trade policy, which will be aligned with the health policy. So the focus where you should need to able to identify the needs in the healthcare sector, and the industrial policy should be geared to satisfy that need. And specifically in Indian context is the low income population healthcare needs. That's a new way of thinking the healthcare technology industry. I think that's what we really needed to go forward. Small changes, creating a sport promotion park or investing in, just small aspect of API industry development. I think that can help, but we need a broader vision.
I'll just add to that. I think Dinar's captured it nicely. I think it's important to probably take a step back and just see what is it that we've learned through this crisis so far, right? So for years, people would have been saying, like Dinar has been writing a lot about the role of industry associations and how they can play a much larger role. I mean, you've seen them come through at a time like this in terms of what, again, others have been calling for. How do you connect startups with some of the larger firms? How do you make sure that industry academia collaborations work better? Numerous examples of innovations coming out of the IITs, which then get picked up by some of the larger firms, and their production lines being used for it and things like that, right? But if it wasn't for the pandemic, then, we would perhaps still have been saying we should be thinking about these things and this should happen. But now that it's happened and people have been able to see very focused, mission-oriented kind of innovation approach, right? We need to capitalize on that. The other thing is, I think public funding came from all sources, whether it was DRDO, ISRO, everybody was involved in, it was a crisis. Yeah. And you all came together to spend on what was required at that point, ventilators, now in the second wave, oxygen concentrators and things like that. I think we should also think about this. I mean, allocating more. We can't expect ISRO and DRDO suddenly to give up their primary, even the railways. They have a particular role, they have a particular function, their research is on something completely different. And suddenly we draw them into this response, which was fantastic that they were able to respond. It shows, I guess, India's, in a way, the industrial things which Dinar, Smita, we've spoken about, the structure of our industrial R&D, which enabled us to respond in a particular way. There's a clear need to spend much more on healthcare innovation and R&D. And the organizations that are supposed to do it should get that kind of support and backing. We can't always rely on, everybody when their core research might be something completely different, suddenly being dragged into. It's amazing and a testament to their abilities that they were able to respond. But at one level, it also shows how important it is for us to really get these partnerships going between industry, between startups, between industry and academia, right? Build on those partnerships, but also allocate a lot more to public healthcare R&D and also make it sustainable for our industry in a way that this continues. It's not like a short-term response. It shouldn't be a case where because we had to manufacture ventilators, okay, 5 people came together, did it, and they're like, okay, now the crisis is over, so let me go back to my own core business. I mean, this is something which has to be looked at from a sustainability standpoint too. How do we make this?
But it does strike me that, in some ways there have been some extraordinary opportunities lost. If we think about, the simple question of how many billions of samples have been taken around the world, we could have done something very different in multi-disease sort of segments. We could have imagined much better, much faster at-home testing. We could have imagined a complete telemedicine did get a big boost. So did a few other things like storage, trucking, sample cryogenics, all kinds of other things. I think from an innovation standpoint, as opposed to more efficient business as we currently understand it, how do you both see this difference? What is innovative that has come out of some of our learnings? Because cancer, for example, you could argue many of the things that would improve quality of life or outcome measures, we already have. So in your own work, how do you think, not just within cancer, but more broadly, how do you think about what we should do for innovation in medical device and diagnostics as opposed to improvements of other kinds in what we have, or even supply of what we have in larger quantity?
I think really documenting what is it that we've learned through this crisis. How do we make sure that, we take the positives away, we ensure that the negatives don't happen, that, people and policies are designed in a way which is independent of who's in power and politics for that matter, right? I think it's very important that we ensure that there is a documentation of everything that we've learned so far, and that when we think about innovation policy, that we need to think of all these different policies that need to be aligned. That is something which I would say perhaps has not really hit home as yet, because we're dealing with a crisis. And so in that crisis, you're obviously doing what you have to do at that point in time, but you're not really looking at it as, can I turn this into an opportunity and really think about, have we brought about the right policy changes? Have we announced the right kind of policies that will ensure that, we have long-term kind of innovation and manufacturing capabilities that we could develop here?
Do you think we are overusing the phrase innovation here? Are all of these manifestations of service delivery or new, even old products, but new service or delivery pathways? I mean, what's going on here? I think for the audience listening to this, the word innovation is so all-pervasive in the media and the business press that they probably look at all of us and say, what do they mean? What will it take? Don't we already have some things that we can use the way that could be better used? Or are we really looking at something new? Could you elaborate that a little bit?
So I would say that if it's really introducing something which, perhaps did not exist, maybe existing elsewhere, but that we're able to kind of focus on the requirements here and we're able to kind of, given the resource constraints and other constraints that we've faced, especially at the time of the supply chain disruptions, we were able to kind of come together and really address certain challenges. And I would say that there was some showcasing of our innovative capabilities for sure, right? I think you mentioned about the other opportunities of maybe the vast amount of data that is there and what that could do to not just focus on COVID-related studies, but perhaps also a multi-pronged approach to understanding maybe related diseases and things like that. There's huge capabilities there also in terms of how we develop maybe AI capabilities to understand some of these things. But then that means really ensuring that we have other policies around privacy and data security and all those other things also working in tandem. We can't suddenly say we're going to become like champions in AI in healthcare without having some debate around those other issues which are very, very important for patient privacy and data security also.
So it's sort of planning and process, right?
Correct.
I think Janak really covered it really well. Now, I mean, just to add to that, I think you don't need a radical innovation every time. You can have incremental innovation, and that as long as it has desired effect on creating the accessibility and affordability. In Indian context, I think the COVID and so what come out from the Innovation for Cancer Care project is that there has been the significant innovation, which you see the innovators. I mean, I understand the innovation is much maligned word, but there has been examples of really fascinating innovation coming from the industry. I mean, even the project I did with Janak and which we continue to work on. And there are brilliant sort of where you don't see, out of the world, products, but there are products which are sort of done a little bit of incremental or a little bit of architectural innovation, and which has gone reducing the cost, improving the access, working in a really under-resourced environment. So, and similar with the post-COVID, you will see another benefit of the post-COVID for me in terms of innovation is creating the understanding that this sort of skills does exist in my neighborhood sort of thing, So, DRDO, you can go to them and talk to them about, and I think that is really important. I think for not having this understanding or knowledge that the skills which I need can be taken from or can be accessed to in my neighborhood is really important part of the post-COVID response. And I think you will see gradually. I mean, if you look at what's happening in Indian fintech sector or edutech sector, I think medical tech sector has the potential of growing or becoming, and it is already there. Some of the med techs are doing really brilliant. But I think the post-pandemic, there will be more focus, and I think there will be real innovation, as we can say, might be start emerging more strongly.
Do you both want to give our audience a few examples of things that you think have been interesting?
There have been numerous examples of maybe, just ventilators being produced at the IITs or RT-PCR kits that have, homegrown RT-PCR kits, reducing the testing times. You have instances of maybe drone technology for social distancing, announcements and things like that. So numerous such examples that have emerged. Many of them perhaps had to be done given the situation and the crisis that we were facing last year, right? We need to track these and see how they grow over time. I mean, that's something which is very important. I think in the enthusiasm of like saying that, okay, we had partnerships, industry coming together with startups, you will have these examples, but maybe 5 years from now, where are these products and have they really gone to a wider audience? Are they being used currently? Because again, in a crisis, you develop in what you can do best at that point. But I think it's important to also track these over time.
To the specific examples, which we can talk about is some of the ones which cover in our paper with Janak, the device to diagnose anemia, for example, in rural parts of India, where, you have the issues of accessibility in terms of the lack of supply, difficult, challenging conditions to work in, and the Indian company comes with an instrument, and again there is a sort of the predominance of, or not dominance, but the anemia challenge is quite real. There is another example from a company based in Pune, which developed an instrument to look at the ENT issues. And then it worked closely with the multinational firm to develop that product, and which has been used widely. So there are, if you look at it, even in cancer care, as you know, Smita, very well, there are lots of examples which show strong innovative capability, and which is what also intrigues me, because it's not very challenging to work in Indian context, and so these, the entrepreneurs and innovators are doing brilliant work in terms of coming up with these innovations. And I think we should do enough justice to highlight them as well.
is there a difference in these sets of innovations where some are less directly connected to the patient? And I'll tell you where I'm coming from. Because, on the one hand, it is absolutely true, and I agree with both of you, that we have realized in the Indian context how blessed we are that we have such wide-ranging capabilities of certain kinds, things that perhaps we even took for granted that India has and a lot of other countries don't have, right? So you can, in a context like this pandemic, you can pick up the phone, you can call someone, you can, right? So despite all of its failings, of which there are many, there are also some extraordinary groups that are in the ecosystem already. But not all of them are directly connected to the patient experience in the sense that they may be quite tech, engineering, and manufacturing supply driven. And in that sense, perhaps not thinking of the immediacy or the improvements in patient experience, or not even patients, people who might be worried about something but need assistance. Do you see these as competing problems, or that they should be better aligned?
I will agree there need to be a better alignment, but it also comes from how you're going to align. It's just not the innovator's responsibility to find the resources for patients to make it affordable, or the innovator's aim is that his product will reach to every patient and make the person's life much better. So there also comes where when I mentioned about installation for health, also the role for the health policy is very critical here in terms of creating those access. And that's where you need maybe innovative insurance schemes or a national health systems, sort of a system where the procurement has, allows you to get this product and create the access to the product to the patient. So it just, you can't really look at just one side of the story in the Indian market, and it has been true with the medical pharmaceutical as well. It's a low value, high volume market. The Indian consumer is a price conscious for the right reason. And as a result, the entrepreneurs are well aware that there is a challenge in terms of creating the product which has to be affordable. But if you want an innovative product, there has to be also where the government schemes, the insurance schemes has to play a role where they can create this access to those products and make it affordable.
Perhaps the innovators play multiple roles, but they cannot play all roles.
Just to add to what Dinar was saying, I think there are two components, right? One is where the innovators they identify there's a market gap and they go for it with the idea that it creates as much accessibility and affordability of that device as possible. Now, whether the device is used by an ASHA worker or a doctor or an individual themselves, right? I think it's about creating awareness about the existence of these devices, the possibilities. Ultimately, the doctor, Dinar mentioned, plays a very critical role, both in terms of even suggesting innovative products, but also in terms of providing inputs to the development of these innovative ideas. One thing you have to guard against, obviously, is any product pushing by any kind of organization or a doctor for that matter, right? But the goal ultimately should be, I would say, educating people as much as possible about the existence of these devices that perhaps through timely interventions could prevent or even cut down life cycle costs for many patients, right? So in Dinar and my study, we were looking at defining, the affordability, not just purely at that point of when that test is or some intervention is performed, but it's also about perhaps thinking about, can it reduce through like preventive or early diagnosis, reduce the life cycle cost for a patient. So I think that's something which, doctors ultimately would have to play a very critical role in ensuring that they're open to these kind of innovative devices, that they're able to train their patients on the use if it's something that's patient-centric. Ultimately, I think we will see a situation where home care is something which, everyone will move in the direction of also. So there's possibly a lot of ideas and innovations that would come about to ensure that this is facilitated.
It's clear that, with e-commerce and so many other new models out there, we expect to get so much locally, even in rural, quite remote areas. The notion that some of this on the healthcare front is so complex still is says something about what is missing.
I think the pandemic has opened our eyes to the challenges as well as what can be done. I think there is awareness that health has finally, it seems to have got the prominent role in the thinking, not only just the ordinary citizen, but everyone from the low-income people to the government policymakers. I think this is an opportunity for us, everyone, to basically do something in terms of designing a policy which will last and prepare us for the next pandemic, which is always going to be around the corner, the way we live nowadays. There is so much potential in Indian terms. We have all the skills, we have all the technologies which can be developed in Indian context. What it needs to support you, policy environment, both sides on the health and industrial side. And if we can develop those policy environment, I think India has potential to emerge as a successful exporter and supplier of medical device and diagnostic solutions in the world.
Of course. I mean, the primary goal should be to, of course, provide our citizens with the best healthcare possible, right? That should be the primary goal. But I think what Dinar is saying, that if thought through carefully, this is a huge opportunity for us. And that's why I think some work that Smita, I know that you've been thinking about how to align industrial policy with health policy, really gives us an opportunity to, become not just suppliers to our own population, but also to the rest of the world. A very simple thing. For example, if you're so focused on our electronics policy, then can we sequence it in a way that we think about medical devices given healthcare, and then we grow electronics through that medium, so as we realize what components are needed and we start growing our medical, the electronics industry in that way, rather than saying, okay, we're going to have a separate just push for electronics the way we've thought about it as now. I think health, definitely the pandemic has shown should be our first priority.
It does feel that historically in India, and certainly in many parts of the world around public health, there has been the big question of, should this be an industry or a sector that makes profitable investments such a priority? Or do you see this as a kind of a necessary evolution where lots of different actors are putting their heads to a problem? How do you frame this?
The most successful medical device and diagnostic industry is based in US. And if you look at the US example, where the funding primarily comes from, it comes from National Institute of Health. The private sector has a role, but the public sector investment has a critical role in supporting that initial seed formatting. Some of that has been done by BIRAC over the years. They have been putting the funds. Some of those funds has really created interesting innovation. The second aspect of in the US, which is really fascinating, is access to the venture capital funds, which is also plays a dominant role for the scaling purposes. Again, in Indian case, it slowly started emerging a lot, especially in fintech and edutech sectors. And, so in medical, I think that's where the focus should be more, where we should be encouraging the venture capital funding for the scaling up purposes, but the public sector investment has to be there in the beginning to support those ideas. In the private sector investment, again, some of those big industrially, we have big industrial groups, and I think they should be also be investing. What we need, a dynamic VC culture and good public sector investment and ambitious private sectors. The existing industrial groups have ambition for the medical device and diagnostics.
Part of the challenge is once you have an investment culture in an industry that clearly is quite essential or part of basic needs of different kinds, it becomes increasingly hard to regulate. But on the other hand, your research with Janak, and certainly some of the work we're trying to do in the ICA project and so on, is also trying to think of ways in which to encourage those who have ideas, which might be more broadly applied, to at least find a way for them to survive in the system.
Yeah.
So it seems like a bit of a balancing act.
There will be some investment which will not bear the fruit. That's how I see it. In terms of regulation, I think that we didn't discuss it, but the medical device sector is it's really dynamic sector, which is taking on board all the new technologies as for example, how you go introduction of blockchain technologies in the medical device sector. It's most nowly, it's a computer software rather than just the instrument. So the regulation has to evolve alongside the technologies, which is really challenging. And, if you look at again the example, those who develop the technology also develop the regulations. We have brilliant IITs, we have IIMs and, Indian Institute of Sciences. I think there are enough centers of excellence where this sort of innovation can groom, provided we have those sort of financial support available. And some of the research which I've done with Janak, examples came from the IITs where, those who got the support, financial support, and they went on to develop those products into the scalable products and made a good business out of them as well. Those entrepreneurs working in an Indian context are well aware that this is a low value, high volume market. If you are there are some products which are developed, which are really at the higher end of the markets, which we come across in our research, but they are targeted at a different, they are not just the India specific market products. But there are lots of, from some of the work which I've done with the Janak and even our ICA project shows that the peculiarity of Indian market or the Indian consumer is quite on top of their minds when they are developing the product.
Given our research, to think about this is to really look at baselines, because it's all relative, right? After all, if somebody is coming up with something that is in principle high volume, it is up to policy regulators and others to think about how to make it high value. This may be also one of our challenges, which is that we're not signaling for a range of reasons in the right direction. And I think Janak's point on electronics as a closed conduit to the development of diagnostics is a good case in point. There's a way in which to signal them jointly as priorities, as opposed to separately in their own complex pathways, which never quite sort of get to the point at hand. So much of what we're discussing here is not taught in economics. It is not taught in science and technology policy in a clear way. It's not taught in development theory or a range of other fields from engineering to science. In fact, my science and engineering colleagues, as I'm sure Janak and Dinar will agree, are often pointing out the benefit of this multidisciplinary conversation precisely because they too are trying to make sense of some of these major gaps.
I just want to thank for a really interesting conversation. It's rarely you get an opportunity to talk with such an interesting group of people.
I would also like to thank you very much for inviting us.
Well, thank you both. And to the audience, thank you for sticking this out with us. These are complex issues that are really affecting everybody's lives these days. As both our speakers have pointed out to us, COVID has certainly shown us all what some of these challenges are, but we've also seen huge changes in the way in which teams have come together.
Thank you for listening to the ICA India podcast. Do follow our social media handles and stay tuned for the next episode.